All right, now we're going to have a chat about dermatomes, myotomes, and DTRs. And let's just talk for a minute before we get started. If you have a sheet of paper, you might want to think through the process of this, because there are going to be dermatome testing. You have a cervical, thoracic, and a lumbar station probably, right? And you're probably not very prepared at this point in your career to do thoracic, myotome, dermatome, and DTR testing really well. So we're going to go through that carefully with you. But I just want to talk about a dermatome test. Since we know you're probably going to be asked to do this not once, but at least twice, maybe even 3 times, let's talk about how to do this and do this well, because field doctors do this all day long. All right, so rule number 1, okay? Step 1 is there will be cotton in the room and there will be toothpicks in the room. If there's 100 points for this, there might be as much as 1 point for that toothpick and 99 points for cotton. So the thing I'm trying to impress you on is forget about the toothpick. Don't worry about the toothpick. I know there's some toothpick schools out there. There's 2 or 3 of you. But don't worry about the toothpick. The cotton is the big thing. In fact, dermatome testing is for peripheral nerve, right? Radiculopathy, peripheral nervous system. It is a peripheral nervous system test. The toothpick is for sharp dull, is for central nervous system. So you shouldn't even be doing it anyway. See my point? Okay, so now let's get back to cotton ball, cotton ball, cotton ball. All right, so we go pick up this cotton ball. The patient sees you picking it up. Okay, so they kind of getting ready. They know the drill anyway. So your job is now to prepare the area. So what is it that they should be prepping? Should they be rolling up their sleeve, taking off some kind of wristband? Should they be taking off their shoes and socks, rolling up a pant leg? What should they be doing? So pick up the cotton ball, have the patient prepare the area. Then your next job is to tell them what this feels like. So if you're doing things up here, I always let them feel it on their knee. Do not do their upper thigh. You get the problem? No. Okay, so let them feel it on their knee. If you're doing their lower extremity, let them feel it on their forearm. So that's the key thing. Okay, so we picked up the cotton ball. We prepared the area. We've let them feel. This is normal. Okay, what I want you to do, see now we're talking to the patient, is compare one side to the other side and see if they're the same. That's all you have to say. Just give a comparative sentence. I know a lot of you I want you to tell me which side you feel it a little bit less on, or which side you feel a little bit more on, and you just drive yourself crazy. What they're going to tell you, I feel it less on this side, so they already know what the drill is. So compare one side to the other. All right, now the next one I have a trouble with some of you on, okay, I want you to do the whole dermatome. I don't want this little thing. No. Okay, or a little dabble do you, a little dabble do you. See, that's that toothpick cotton ball schools, okay? I want you to do the entire dermatome. And I really like you to do it twice. Okay, that way the patient's not confused, the doctor's not confused, and I like you to say the number that you're testing too while you do it. Okay, we're going to compare C5 to C5. How'd that feel? Oh, the same, doctor. Okay, now look at how C6 is going to work out for you. We're going to come down here and do the thumb, then we're going to come down here and do the index finger. You see how good it was to do it twice? So does this feel the same as this? So now we've done it twice. Okay, yeah, doctor, that feels the same. Okay, does this feel the same as this? And you see, by doing a little one twice, you got a chance for the examiner to see it or to look up while they're checking things off. All right, now, there was an important thing I left out there. Before you started doing the entire dermatome, I didn't get any points and my patient said they could feel all of that, right? And yet they told me the pain radiated into their index fingers. So what did I leave out? Okay, so here it is. Let's backpedal. I pick this up. I have them roll up their sleeve. I have them take off their wristband. I tell them this is what it's going to feel like. I want them to compare one side to the other. Now please shut your eyes. Otherwise they'll say, yes, doctor, I can feel it. Yes, doctor, I can feel it. Yes, doctor, I can feel it. Yes, doctor. And in fact, if they're really trying to be nice and they know they're not supposed to feel this side, they might even say this to you. Yes, doctor, I can see it. Yes, doctor, I can see it. Are they being jerks or trying to help you? They're trying to help you. So have them shut their eyes. Okay, so now we've done all of our testing back and forth. So now what do we have to tell the patient? Open your eyes. Otherwise, what is your patient until you tell them to open them? Blind. Okay, so put all of that down or re-listen to this again, but that's how we do a proper dermatome. All right, so we've got Ben back. We're going to actually we'll do a cervical, thoracic, and a lumbar sample for you. But what I want you to also understand is that you don't have to do the posterior aspects of any of these dermatomes. You only have to do the ones that I've got listed in the book, and realize every dermatome chart, you probably even had 2 or 3 dermatome charts vary in your own school setting, and say, well, which one do I go by, you know? And so realize the ones that I put in this book, they're old, they've been around forever, they're the old choosage ones. It doesn't matter if you understand that or not, but these are kind of tried and true and probably the most accepted for national testing. So now, if I go get this, okay, and I tell Ben, okay, we're going to be doing some sensation testing on you, and you're having some pain and difficulty today, this will help me find out what's wrong. So what I want you to do is kind of roll up your sleeves, so he'll do the best that he can, and they're pretty far up now. Okay, so thanks, that'll work good. If you had a wristband on, we'd have him take that off. Now, I want you to see what this feels like, so you feel that on your leg. Okay, you're going to compare one side to the other, and I just want you to put your arms out like this. Okay, and I want you to shut your eyes. Okay, now you tell me if this feels the same as this. Okay, alright, does this feel the same as this? Okay, and how about right here? And right here? Okay, and we're going to do C8. Oh, I wasn't numbering them, was I? And now compare C8 over here. Okay, alright, and then we can compare them. So go ahead and open your eyes up, and he said everything felt the same, so he obviously is in great shape. Now when we do the thoracics, I want you to stand up and step over here to the other side of this. Your patient may or may not have on a gown, but I want you to face the screen. Okay, we'll have to open the gown up. Now let's talk a little bit about opening the gown up. When you open someone's gown up, you don't have to say, pretty please, can I, is it okay? Just tell them you're going to need to open their gown up and tell them, you know, that's just the fact of life there. Now you just say it in a nice way, but this is what it feels like. You're going to compare one side to the other. And I would put my finger in the middle without touching them with the rest of my body and say, okay, T1, does that feel the same on both sides? Okay, how about T2? Does that feel the same on both sides? T3, does that feel the same on both sides? T4, does that feel the same on both sides? So that you're doing all of them. If you've been asked to do T1 through T6, that's what you do. T6 through T12, that's what you do. But if they ask for them on the posterior, that's what you have to do. Now I want you to lay down on the table here supine for a second.
Ahead of here?
No, you head down there. And ooh, is his head on that? Let's slide down this way a little bit. You're gonna have to be uncomfortable. But okay, if you are asked to do the front of a patient, they're never going to ask you to do T1 through T6 on the front because the T7. They'll never ask for any of this because they don't want you messing with breast tissue or anything. Not even on a male will they ask that. But if they do ask for T7 through T12 anterior thoracics, they've done it, then this is what I want you to do. I need you to raise the gown up and your shirt up, so we need the belly exposed. Okay, so we're back to that again. Sorry, I forgot about this one. Oh, and we're going to do Mr. Tickle here. Okay, so I'm going to do it in the air, because it just is probably more than he can bear. Okay, but realize the xiphoid is T7, okay, and it's going to be in this angle. But remember, the umbilicus is T10 straight across, so you've got it. I want you to practice this so you get the art of this. So 7 is angled down, okay, then T8 a little less of an angle, T9 almost no angle whatsoever, so that T10 is an angle, but remember, inguinal ligaments are coming, right? And they're going to angle like this. So now once I've done T10, 11 is going to be angled up slightly, and 12 is right above the inguinal ligament. So that's how you got to do T7 through T12, and I want you to practice that a few times. The posterior thoracics are easy peasy, but you've got to count, because there's no way he can see this. I would still have him shut his eyes and focus, because he may have a cervical case and a thoracic case that he's memorizing for Saturday and Sunday. So, and he might have been told, you know, if they don't have you shut your eyes, don't tell them anything. So I would probably still do the eyes shut, eyes open routine. Now, go ahead and lower that. You're fine. Let's talk about the lumbars. In the lumbars, slide up just a little bit this time, so we've got your legs front and center here. Okay. Now, if you'll notice, I really think it's wise for you to do the lumbars with the patient supine. Here's why. Your field doctors don't crawl on the floor. So I don't want you palpating the pulses. Remember, how did I do the popliteal pulse? I had the patient bend their knees, right? Then I did the posterior tibial, then I did the dorsal pedis. I didn't crawl on the floor. I'm 60, I don't crawl on the floor. Most of your field doctors, after 3 minutes in practice, go, I ain't crawling on the floor anymore. And they figure out how to do everything supine. So now to do the lumbars, okay, we're going to do the patient supine on the table, not crawl on the floor. And so I'm going to have you shut your eyes. This is what it feels like. Compare one side to the other. Okay, now here we go. L4 is medial all the way down to the big toe. L4. Okay, now if you want to do it twice, that's fine. So we'll get the rhythm going. Does that feel the same as that? And that was L4. Okay, now we're going to do L5. Come down here, and then don't do the lateral malleolus. Do the top of the foot. Okay, so let's do this faster now. Does that feel the same as that? Okay, and if he says yes, then we move on. Now take a look at S1. We're going to do the lateral surface and the bottom of his foot. The lateral surface and the bottom of his foot. Okay, I'm trying not to tickle Ben, but okay, so that's S1. Now, if everybody notices, I don't do the posterior calf, because a lot of books say the posterior calf is S2, some say S1, some say half of it's S3. I mean, it's just a happy horse race for the posterior aspect of the calf. So this is what we're going to do. We're going to do the medial for L4, the lateral top of the foot for L5, the side and the bottom for S1. Everybody got it? Okay, because L4, L5, S1 is on every single test. Practice. All right, now dermatomes are going to show up. You know absolutely for certain they're going to show up. Remember, they're going to tell you to do skin on skin at the best you can. So Ben had on a t-shirt, so I did it over his t-shirt. But really and truly, your patient will probably just have on a gown if they're going to do the dermatome. So you should be able to have a skin-on-skin approach to even the posterior thoracic spine. But remember, counting is the key. Counting is the key. I'm doing C5. Does that feel the same on both sides? C6, same on both sides. T1, is that the same on both sides? T2, is that the same on both sides? I'm doing L4, is that the same on both sides? So practice, practice, practice till it's second nature. Okay, go ahead and open your eyes up. Let's sit you up. Let's just practice, practice, practice. And make sure that when you're practicing with a partner or a family member, have them, surprise you with a positive finding, so that, you're saying, okay, so you didn't feel as much on this side as that side, so that you're following up with the patient, doing the proper language.